study says that it may not be as good as we think it is, but it has not proven yet. Therefore, if you see it on the test, then yes, it is good to reduce, to lower lipids in the body, of course. Anybody with cardiac issues, they still recommend to take omega-3 acids, fatty acids. Emotional support. What is it?
Can you repeat that, please?
I couldn't hear you.
Can you repeat that about the omega-3s?
Yes, the omega-3 is that to lower the lipids in the body, omega-3 fatty acids are good. They comes in pills. A lot of fish has a lot of omega-3. It helps with people with cardiac problems. And omega-3 is good for cardiac issues. But then yet, evidence-based, the latest thing has said that it's not as good as we think it is. There comes in pills. I don't know if any of you have taken it, like fish oil in pills. And the owners say that it's good for the heart and for the skin also. People say that. But then yet, it may not be as good as we think it is. In order to be successful in the cardiac rehab for cardiac patients, emotional support must be given. The patient has to be supported emotionally in order to be successful in a cardiac rehab. They have to be motivated to be part of the program. The patient motivations will guarantee the success of the program. Many of the patients probably will experience depression and low motivation to participate. So when they come to participate and they say, no, I just want to watch, let it be. Let it be, and later on, obviously, it has to be emotional support, because in order for them to buy in, they have to be emotionally stable. Counseling will be important for them. And it's recommended that when they do rehab group therapy, not to call on them, because they go in and they're gonna just sit in watching. And I don't know what it is, but when it comes to the heart, people do get depressed more than any other diseases or any problem. So I see many patients sitting there, and the PT or anybody, the nurses, do not call on them to ask how you feel, what do you think of, not, just let it be. Just focus on the ones who are participating, and then put in a counsel for the ones who do not participate. Just put in a counsel, and they will come and talk to them. So, and they tend to become immobile. They stay in the room, they don't want to do that, so just make sure that you encourage mobility. These are the persons who may benefit from cardiac rehab. Lower risk patients, I put all this in there because questions may be coming out from here, so I want you to make sure that you read that slide. So lower risk patients after acute cardiac event. Not everybody can go to rehab having heart problems. Low risk patients after having acute cardiac event, yes. Patients who have undergone coronary bypass surgery, they could. Patients with chronic stable angina, yes. Heart transplant. Heart transplant too, yes. Coronary angioplastic is important. Yeah, number 5 bullet. These patients right here benefit tremendously from coronary angioplasty because the diet will help them tremendously, diet and exercise for those type of patients. So it's very appropriate. Unlike patients who had a severe heart attack and it has a lot of ischemia, they will not be beneficial. But if they have a heart transplant, yes, they will. But those patients with MI, patients with severe ischemia will not benefit from cardiac rehab. Patients with a stable heart failure, yes, they can. So they have to be kind of healthy somehow to benefit. If they are totally gone, if they heart attack, they have too much ischemia, no. If congestive heart failure is very difficult to treat, no, they will not benefit. There's a lot of at stake here with those patients. Look at the phases of cardiac rehab. We have 3 phases of cardiac rehab. The number one, there is going to be the first phase of it is going to be a visit from a cardiac rehabilitation team on the phase 1. And they are going to talk to the patient, assess where the patient is at. They have to be somewhat healthy to benefit from the cardiac rehab. Education regarding the disease and recovery process will happen in that phase. On phase 2, it lasts 3 to 6 months in phase 2. It's supervised, but it's ambulatory outpatient program. And on that phase, the patient already enters into a controlled exercise, which includes frequency of exercising, the time and intensity of those exercises, and they are under the physician control. And usually lasts, like I said, 3 to 6 months. So we pay attention to phase 2 about that 3 to 6 months of supervised cardiac rehab for those ambulatory outpatients. Phase 2. Now we move to phase 3. Now is the lifetime of maintenance phase. There is a lot of education here as far as physical fitness, because they feel that they can do it all, and not really, but they are independent at this point in phase 3. Looking at pulmonary disease, guys. We have, according to American Lung Association, 450,000 Americans die early from lung disease. There is a lot of problems with COPD, with chronic obstructive pulmonary diseases. Lung disease is the number 3 killer in the United States. More than 35,000 Americans have chronic lung disease. We have acute and or chronic lung problems. Look at those definitions out in your book. It's important. Deconditioning, malnutrition, chronic effects of hypoxemia, hyperinflation. What all those means? Those definitions there. If we focus on COPD, which includes the chronic bronchitis and emphysema. With COPD patients, they do benefit from cardiac rehab. There's a lot of education about BiPAP and CPAP. Have you guys seen that BiPAP, where they have that mask on their faces? And People will have to wear those to sleep. I don't know how they do it. The sound of it is terrible, but that forces the air into the lungs. With COPD patients, if they have any aerosolized things ordered, such as nebs that you have to do, you cannot hook it up to the green oxygen because it's gonna retain CO2. So you put it into the yellow because that's compressed air for the COPD patient. When they use albuterol or atrovane in a neb, which means hook it up to the yellow, which is, have you seen that on the wall, right? A yellow and a green. So the green is oxygen, but you don't want to give that much oxygen to a COPD. With COPD, they were exposed to air pollution at work or the environment. That's how it starts for them. History of childhood respiratory infections. And low socioeconomic conditions also seems to be a contributing factor for the COPD. It's not the same thing as asthma, of course, but asthma, people who has asthma who wants to share here, and how does it feel? How does it feel when you have one of those attacks?
Well, I haven't had one in a really long time, but it used to be really bad when I lived in the country, because I had all those environmental
Factors?
factors that exacerbate it, but essentially, you just feel your airway, like,
Closing?
yes, and it just gets harder to breathe, so you start kind of freaking out because it's like, I can't
No
breathe.
air is coming in.
Right, and, yeah, it's just really hard to breathe through that.
So you get any pumps?
Oh yeah, I have an
You have-
albuterol and I also have a nebulizer. I used to take the steroids, but I'm not on that.
Okay.
Yeah.
Does humidity exacerbate that? Humidity or not?
I don't think so. It's more heat, exercise, pets, some like certain sprays, like aerosol sprays. It just,
Now, can you imagine doubling or tripling for a patient with COPD? It's tough. That's what immediately this BiPAP has to go on. That way it forces the air to the lung because they feel like they are closing and they can't breathe. Yes, kind of tough. Thank you for sharing that. So there is a chart on page 339 that is good for you guys to look into this, that you can see. And we have 2 more slides and we are done. Other respiratory conditions that maybe benefit from pulmonary rehab will be asthma. There are programs for people who are asthmatics that help them out. Cystic fibrosis, lung cancer. And usually what we're trying to do is in those programs, they teach people, they educate people about conditions of what exacerbates it, what is the best things to help them, is to maximize breathing. Obviously, that's the goal of it, of these programs. They're gonna enhance the coping mechanisms of what to do, and a lot of education, of course. So pulmonary rehab is indicated for with chronic lung disease who have received optimal medical management but are still symptomatic. Okay. So symptoms of that, or patients with dyspnea will be helpful for those type of patients.
This slide isn't in our.
It's not in there? Oh, okay. Then the only, you have that one?
Yeah.
So disregard that one. I don't think there is a test on that because I don't have it marked here in my notes. So don't worry about that. That number 13 goes into this one. Nursing interventions. So I took it out for a reason, I guess. I saw you guys looking at me like, what's talking about? Look at it like, it's just a definition, but all right, don't disregard that one. So nursing